students of third year biomedical engineering. Here we gonna discuss a case study on mammography. So I'm Lokeshwari.
I'm Latika.
I am Mithuna.
And I am Daphne. So, what is mammography?
So mammography is the medical imaging technique that is particularly used in low dosage X-ray system, particularly to examine the breast cancer. The goal of mammography is to detect breast cancer early, that is in treatable stage.
So, let's see patient's history. The patient name is Sarah and she is 48 years old. Sarah has no history of breast cancer and her family members also does not have any history on the cancer. And she has 2 children, okay? So, Sarah does not consume alcohol or does not have any bad habits. She has a good and healthy food habits. So why does Sarah need mammography? As a part of routine checkup, she went to her physician, and as her age is above 40, he recommended a mammography to just for a regular checkup.
Mammography procedure. Sarah underwent digital mammography in the nearby local clinic. There the test underwent for 20 minutes and there they used 2 X-ray images of each breast. The one image is of top to bottom of a breast and another image is side to side. The procedure was a little painful for her because of compression of a breast to detect it clearly. Results and findings. The radiologist detected 3 results from the mammography procedure. The first result was microcalcification. Microcalcification means small calcium deposits were present in one part of a breast. Then the second findings was they were asymmetrical density. They found that in one breast the density of the tissue was very large. Then the third was no lumps were detected in a breast, so there was no cancerous cells.
So what would be the diagnostics of mammogram? So mammogram used the additional images to focusing on the clear images of the cancer, and also a breast ultrasound was performed. So mammogram used additional images focusing on the areas of cancer. It will be focused where we have the breast cancer tissue, maybe long or small or high. So it can be easily consumed in specific images, and also ultrasound helps a breast ultrasound was performed to provide further details about the dense areas seen in the left breast.
What is the diagnosis and treatment plan? Final diagnosis and treatment plan. Results. The biopsy revealed that ductal carcinoma in situ, a non-invasive form of breast cancer where abnormal cells are found in the lining of the breast duct but have not spread outside the duct. There were 3 treatment plans which were suggested by the doctors. The first one is surgery, the second one is radiation therapy, and the third one was hormonal therapy. In surgery, Sarah underwent a lumpectomy to remove the teeth. In radiation therapy, after the surgery, she received radiation therapy to reduce the risk of recurrence. The third treatment plan was hormonal therapy. Since the tumor was hormone receptor positive, Sarah was prescribed tamoxifen, a drug that blocks estrogen effects in a breast tissue. So what is the outcome of this?
So Sarah's procedures were excellent as DGIS is highly treatable when detected early. The mammography has successfully identified the cancer in stage where it had not yet become invasive. The regular mammography screening in the early detection.
This case illustrates how mammography plays a crucial role in detecting breast cancer at its early stages. The following key points arise from Sarah's case. First is the importance of regular screening. Mammography can detect breast cancer long before symptoms appear. So Sarah's case shows how early detection can lead to less aggressive treatments and better outcomes.
Follow-up diagnostic testing. Not all mammography findings are cancerous, but follow-up testings like diagnostic mammography, ultrasound, and biopsy helps to clarify and identify the suspicious findings. Non-invasive cancers. DCIS is a common type of early stage and non-invasive breast cancer, and it has excellent progression when caught early.
We have to give awareness about the breast cancer, right?
Yeah, we have to educate the people because cancer was uncurable thing. So if we have any symptoms regarding this, we have to consult the doctor. Every woman should self-examine herself. During every month, she should self-examine her breast. If she felt any lumps, then she should immediately visit doctor. Not only lumps are found in breast, but also in the breast cancer lumps they are also found in the armpit. So that is also very important. So she should self-examine every month.
I think they should go a regular checkup to the doctor.
And it is said that women who are like 40 plus years old are more affected by breast cancer, and it is as we saw in Sarah's case, it is mandatory that women who is above 40 years should take a regular mammography or something so that they can detect it earlier. So if when it is detected early, we can cure it. Let's conclude this case study. Mammography remains a critical tool in fight against breast cancer. Early detection through regular screening allows the timely, drastic improve survival rates. Sarah's case employs that value of routine mammography is identified breast cancer is most treatable stage.